Hello and welcome to Building Caregiver Resilience, DANCE. Resilience is the ability to adjust to change or adversity. Caring for a person living with dementia requires us to be resilient in order to keep up with the many changes along the journey. Learning more about dementia by attending a family caregiver series or watching the other recordings provided here, particularly our foundational topics, will help you build your resilience as a caregiver. For now, just remember the acronym DANCE. DANCE is don't argue, accept the disease, nurture your physical and emotional health, use creative problem solving, and enjoy the moment. These are the core principles of caregiver resilience. We'll start with don't argue. Reducing arguments will help build resilience. It's important to remember that dementia is the result of a brain disease, and that the person living with dementia is often in a different reality. For example, they may not be aware of the changes in their memory or abilities, so they may believe they ate lunch and they paid the bills, but they didn't. When we try to pull the person into our circle of reality, we will usually create an argument, and then there's more distress for both the caregiver and the person living with dementia. The more arguments, the more distress. Therapeutic fibbing is one way that we can validate their reality and reduce arguments. And to learn more about this technique and others, have a look at the recording, Understanding Communication. Just remember that the person with dementia has a brain disease, and that brain cannot always join us in our reality, but our brain can shift to validate theirs. If you're not familiar with the brain changes that are part of dementia, watch the recording, Understanding Dementia, Dementia, and the Brain. A is for accept the disease. There are many emotional phases that people experience when they react to bad news, such as a diagnosis of dementia. These emotions can be experienced and re-experienced in any order throughout the journey. There are no time limits to how long you spend in each emotional state. You also may find that while you're at one emotional state, a person in your family is at another. For example, while you are experiencing sadness and despondency, your partner may be in denial. Or perhaps the person with dementia is experiencing anger and frustration while you are in shock and numbness. Shock and numbness can often come at the beginning where the diagnosis occurs. The diagnosis can be a complete shock, and it will take time to adjust to this news. Numbness can come when a person does not want to feel the emotions associated with this information. Numbness can often present as a person who wants to stay very busy and very occupied, a person who's too busy to feel their feelings. Disbelief and denial appear as, well, this can't be happening to me, or it's not as bad as the doctor says. This is probably normal aging. In the beginning, denial can be a positive, protective force. We use denial to shield ourselves from painful news while we adjust inwardly to a new reality. J.W. Anthony said, "A degree of denial is essential. Like drinking hot coffee, we sip the truth of our condition carefully and gently." Many people feel angry and frustrated about this diagnosis, and angry and frustrated throughout the journey. They may be angry at themselves, at other people, at the healthcare system. They may be angry at the person with dementia or family members. However, some people also experience a sense of relief after a diagnosis. A sense of relief that there is a medical reason behind the changes that they've noticed. Despondency and sadness often occur throughout this journey. People often feel helpless and powerless in the face of this diagnosis. Caregivers find they are confronting their own limitations. They cannot save the person or fix the person. And caregivers often express sadness when they consider the losses that this disease has caused, the changes to their person as time goes on. Sadness can also be attached to worry and fear about what will happen next. Acceptance in the middle does not mean that you are happy about the situation. With acceptance, you are accepting the problem rather than avoiding it. You are realizing the situation must be adjusted to, that you need to change your approach. Acceptance will involve recognizing and becoming reconciled to the limits of the body. It is not a permanent state. It is something that weaves in and out of our lives, along with the other feelings. N is for nurture your health. As a caregiver, you give a lot of yourself to someone else on a regular basis. Over time, this prolonged exposure to stress and the demand for your empathy and understanding can negatively affect your physical and mental health, leading to burnout. When someone is burnt out, they have reached their limit. It's the body's way of telling you, you must stop. The body will do this by draining you of your ability to keep going, to keep doing your daily activities. Signs of burnout could include a state of exhaustion, a lack of energy, difficulty concentrating, inability to make decisions, a fear of asking for help, becoming socially isolated and distancing yourself from people you care about and things that you used to enjoy. For some people, burnout can present as physical pain and discomfort, frequent headaches, backaches, stomach aches, and getting sick. Sleep disturbances, feeling sad, depressed, irritable, feeling guilty, and feeling like a prisoner in your own life. One of the biggest impacts of burnout is a decline in motivation and disengagement from daily activities. So taking a break from the challenges of caregiving, even temporarily, even for a very short period of time, can reduce your risk of burnout. C is for creative problem solving. Let's start with setting realistic goals for yourself. For example, if you're a person who really wants to make time for exercise in your life and you're struggling to do that, an unrealistic goal would be to set aside 2 hours every day for a hike. However, a realistic goal might look like, 10 minutes a day, walking to the grocery store, a hike once a week. So setting a realistic and reasonable goal will help you reach success. You can work your way up from there. If your goal is unrealistic, it's easy to get discouraged. You may find yourself neglecting the goal and giving up on it altogether. Be forgiving of yourself. Expect to make mistakes on this journey. There is no such thing as a perfect caregiver. A strategy that works for one person with dementia may not work for another. A strategy that worked for you on Monday may not work on Tuesday. You will learn more as this journey progresses, but not without making mistakes to learn from first. Be flexible. Dementia is unpredictable. You will need to make changes to your home and your routine and your lifestyle as this disease progresses. Try to be flexible with the changes that come. It will help you adapt and cope with them. Remember that all behavior is an attempt to communicate. Keeping this in mind when faced with a behavior that leaves you feeling frustrated or defeated can help put the behavior into perspective and better position yourself to problem solve a response. Some of the great things that happen when creative problem solving is implemented include caregivers who find they can take some more time for themselves. They may be able to involve more family members in the care. Caregivers find themselves learning patience, learning about the disease and understanding what is happening, developing new skills, and learning to say no to others. Taking care of yourself grows resilience. It doesn't mean me first, it means me too. Remember, resilience is something that's developed over time. It's the ability to forge on, to endure, to respond to change, and successfully cope with your new normal. And this new normal is usually because of a challenge, a problem, or something you did not anticipate or expect, like becoming a caregiver. Your mind and body require attention and care to meet this challenge. So remember, your health is important, and that prioritizing your self-care enables you to better support the person with dementia. Maintaining your health helps you support the health of your person. E is for enjoy the moment. In order to enjoy the moment, we have to be in the moment, and this can be tough, especially for caregivers who are constantly planning, anticipating, problem solving, always thinking, and always doing. So mindfulness is about paying attention to what is happening within you and around you right now, without judgment. It's observing your thoughts, observing your emotions, observing the sensations you feel in and on your body, and observing the actions you're doing and those in your surroundings. Practicing mindfulness can help you cope with the demands of caregiving by increasing your ability to focus on how you're feeling in the moment. It's about building self-awareness, which builds resiliency. A great analogy for this, for mindfulness, is a busy highway. Picture a busy highway where the traffic represents your thoughts and emotions. It's crowded on that highway, and you spend most of your time running around on the highway trying to stop the cars and redirect them. It generally doesn't work out well. Mindfulness is the ability to sit on the side of the highway and simply watch those cars pass. You're aware of them, but you're not trying to stop them. You're aware of your thoughts, but you're not trying to stop them. Benefits of mindfulness can include reduced stress and anxiety, lower blood pressure, improved immune function, increased empathy and coping mechanisms. You can be mindful in any moment. It does not have to be a large task. Be present as you sip your morning coffee, or wash the dishes, or walk the dog. And mindfulness can be practiced alone or with others. You can practice being mindful in any moment. We can practice being mindful right now. Just draw your attention to how your feet feel on the floor. Now notice the weight of your body on the chair. Notice where your shoulders are positioned on the chair. Now lift your shoulders up to your ears and tense. Drop your shoulders and feel the tension release. Take a deep breath in and breathe out. And we've just had 10 seconds of mindfulness. As you proceed on your caregiving journey, remember the rose garden. The rose garden is about seeing the full picture, your ability to change perspective. A rose garden is filled with beautiful, lush, vibrant greenery and flowers, but there are also plenty of thorns. There will be some days when the thorns are all you can see. Caring for someone with dementia is hard, and there will be thorny days. There's no denying the difficulty of the caregiver role. But just remember, it is possible to see the beauty beyond the thorns sometimes. The roses are there. It is not an easy shift to make. It doesn't happen every day. It will take time and practice. Some of the roses of caregiving, some of the positives that caregivers share with us, are the opportunities to really connect with their person living with dementia. Connect like they never have before. Some caregivers report that they've learned so much more about their person, especially about their past. They've heard stories from long ago that were never shared before. Other caregivers have shared that they've learned to live more in the moment, to be able to show up and be present, to appreciate the simple things. Sometimes caregivers find that their family helps, and they grow closer to other family members on this journey, and they start to work more as a team. We are going to close this presentation with some affirmations for caregivers. Reciting daily affirmations is one way to change your outlook on a deeper level. The more we tell ourselves that something is true, the more inclined we are to accept it as so. Some things that you can say to yourself that might help you feel better are, I'm doing the best I can. I am a competent caregiver. I need and deserve time for myself. Each day I am learning to be kinder to myself. You can try writing out a set of affirmations and putting them where you can easily see them, such as your fridge or your bathroom mirror. Affirmations work best when they are spoken over and over again. It takes a lot of courage to be a caregiver, and courage doesn't always roar. Sometimes courage is the quiet voice at the end of the day saying, I will try again tomorrow. And that is resiliency, the willingness to try again tomorrow, to keep going, to keep facing the challenges and the changes that are required on the dementia journey. We hope you have enjoyed this recording. This slide is showing you how to contact us, and we hope that you do. If you have any questions about the information you've heard here, or any questions about living with dementia or dementia caregiving, please call our First Link Dementia Helpline. The helpline is open Monday to Friday from 9 a.m. to 4 p.m. The English Dementia Helpline will be open until 8 p.m. Thank you again for joining us.